PowerPoint number 8. We are on Chapter 6. I am now going to go through patient record documentation guidelines, which would be inpatient, outpatient, and then we're going to finish up with physician office. So let's still talk about here medical record forms. So we have the anesthesia record, and this is required when a patient does receive an anesthetic other than local. So the anesthesia record, post anesthesia progress notes, recovery room provide complete documentation of the administration of pre-op meds. The content of anesthesia is pre-anesthesia medication administered, including time, dosage, and effect on the patient. You're going to do appraisal of any changes in the patient's condition. And then anesthesia agent administered, what kind was it? This includes the amount, what technique did they use, what effect did it have on the patient, and how long. You're going to look at the patient vitals, blood loss, any transfusion, or IV fluids. So standards. Medicare requires documentation of pre-anesthesia evaluation note to be on the record within 48 hours prior to surgery. And then post needs to be on the chart 48 hours after. So then we get into the operative report. So let's talk about the gross findings. Okay, these are going to be the organs. And again, when you talk about gross, this is what you can see with the visible eye. So the organs examined visually or palpated, any techniques associated with the performance of surgery. It has to be dictated or handwritten immediately following the operation and then authenticated by the responsible surgeon. Documentation includes who were the participants. Surgeon, was there an assistant surgeon? Was there pre- and post-operative diagnoses? Surgical procedure performed, what type? Again, the anesthesia, indications for surgery, and what was the condition of the patient? A detailed description of the operative procedures performed. And you're also going to have a description of the findings. And make sure that the date and time of surgery is documented. The Joint Commission requires a surgeon to document the following prior to performing the surgery. So we talked about the history and physical. That has to be done beforehand. They have to take lab and then x-ray examination. And then you also need a pre-op diagnosis. Remember, your pre-op diagnosis and post-op diagnosis may not always match up. All diagnostic and therapeutic procedures should be documented in the patient record. And this report is to be filed in the patient record immediately after surgery. The outpatient prospective payment system. This is for major and minor procedures. Minor procedures are usually performed in less than 5 minutes, where major procedures are performed in 5 minutes or more. Endoscopies are classified as a distinct group, regardless of duration. When we get into this, this is where we get into global charges. Keep in mind, if it's a major procedure, any follow-up visit within 90 days of that major procedure is included in that one charge. Where a minor procedure, 10 days may be the post-op period. So if they come back in for stitches to get removed, that should be included in that additional first charge that was billed. The pathology report. This or tissue report, and remember, you may see it as histology. This assists in the diagnosis and treatment of patients by documenting the analysis of tissue removed, whether it's biopsy or it could be anything expelled by the patients. This could be products of conception, anything that they take out of the body. And when we get in here, again, I talk about gross, which is macroscopic. This is what you see with the naked eye. Microscopic exam is what you're going to see with the microscope. The pathology report is filed in the patient record as soon as completed and usually within 24 hours. Once again, your pathology diagnosis could be different than your pre-op diagnosis. And the contents of the pathology report are as follows. Again, you're going to do your examinations, you have diagnosis, you're going to look at the tissue, you need the date, and then of course the pathologist needs to sign. And again, the original pathology report needs to be filed in the patient record, and a copy is maintained in the pathology department. Recovery record room. After completion of surgery, the patient's taken the recovery room. This is where the anesthesiologist, they have the nurse in there. They need to, again, document the patient, how they're doing, how they're recovered, level of consciousness, condition upon arrival, any complications, consistently monitoring their vital signs. The Joint Commission requires patients' post-operative status to be evaluated upon admission to and discharged from post-anesthesia recovery room. There needs to be a record of the vital signs again, along with the level of consciousness, any IV fluids, and drugs administered. Your ancillary reports are documented by such departments as lab, chemistry. Again, this is any blood, radiology, nuclear medicine, which would be stress tests. Now keep in mind your lab and chemistry not only could be a blood work, but this also could be maybe a urine analysis, anything that they would do in the lab. The responsible physician must document requests for ancillary testing to be performed in the physician orders, and that patient record must include documentation of ancillary report results as well as the treatment plan. Standards. All ancillary reports should be filed in the patient's record as soon as interpretation has been made. Usually this is within 24 hours. You're going to have test orders, reports must be signed by the person performing the test. And the original should be in the health record and a copy in the ancillary department. Okay, then we get into nursing documentation. Okay, this is a crucial role in patient care because, again, majority of the care delivered to inpatients is performed by your nursing staff, which this could be registered nurses, LPNs, and CNAs. So the Joint Commission states that your nursing documentation has to have an initial assessment. They have to reassess, a diagnosis, their needs, any interventions identified to meet the nursing care, and what care was provided, and the patient's response to this. Types of nursing documentation. You have the care plan, the notes, you have a nursing discharge summary. This is different than the physician discharge summary. A graphic sheet, which is going to show temperature, pulse, respiration, and what medications were administered. And then remember the bedside terminal, the other wording for that is point of care. So again, look at the definition for all the terms. Find examples of all the different nursing documentation from your chart packet. Okay, different special reports. We have the obstetrical record. This is the mother's record, and this contains antepartum record, which is anything before the mother goes into labor. So anything, the history and physical, monthly visits, bi-weekly visits, weekly visits, and then the labor and delivery record, and then the postpartum record. This postpartum is after the placenta has expelled, and then we're getting into postpartum, which is going to be 6 weeks. Antepartum starts right in the physician's office. History of the mother, family social history, pregnancy factors, risk factors, care during pregnancy, tests performed, medications, and so on. And then labor of delivery. This records the progress of the mother from the time that they get admitted till they deliver. It includes the onset of when the contractions start, severity of them, medications that were given, the patient and fetal vital signs, and how well that patient progressed in labor. Also, there is APAR scores, which we will talk about them. And then the postpartum record are documents information concerning the mother's condition after delivery up to 6 weeks. Neonatal. This is our birth history. Summary of the mother's birth or of pregnancy, the labor and delivery, and newborn's condition. Newborn identification, again, immediately is footprints, fingerprints of the newborn are created. Matching wristbands are placed within 12 hours, and I think this has even changed. They do this now immediately after the baby's born. They do a physical exam, which is, again, the assessment of the newborn's condition, and then they do progress notes. Okay, the APGAR scores. This will go on the mother's chart and the baby's chart both. So sometimes it'll go on the birth certificate, but A is for appearance, which is the color, skin color, the pulse, the grimace, the activity, and the respirations. And these get measured every 5 to 10 minutes, and hopefully they go up each time. Charts. And again, for this here, just kind of check things out, be familiar. Autopsy report. This is an examination of a body after death. This includes macroscopic. Okay, again, this is with the naked eye, gross examination. Microscopic, again, is with the microscope. This is of the organs, any tissues. They want to figure out the cause of death or extent of changes produced by disease. So then you have a report. This is completed for any suspicious death and sometimes untimely death. So if somebody's fairly young and dies of a heart attack, they will do an autopsy. Hospital outpatient. Okay, now again, outpatient, we talked about this. It's defined as medical or surgical care that does not include an overnight hospital stay. So it's not longer than 23 hours, 59 minutes, and 59 seconds. It includes diagnostic, therapeutic, and ER services. It also includes observation. These are all outpatient services. Outpatient records. Patient registration. It's similar to inpatient, but a little bit different. It depends on the complexity of the services. Short stay records. Physician office records. Okay, so this should contain a patient registration information. Again, the chart's going to start off with a problem list. You're going to record all the medications and progress note what happened during that visit that they came in. A lot of times they'll have an encounter form, super bill. This captures all the charges generated during an office. So the doctor will circle what level of service, the diagnosis, and they'll hand it in for billing purposes. Again, with the physician offices, they have a lot of their forms come over from the hospital. And again, if they use a sectionalized chart, which we talked about, or source-oriented, everything's going to be put together. Radiology, ancillary, different ancillary. We could have lab in there, correspondence from different hospitals, and then the notes of their visits when they've seen the doctor. If you have any questions over this PowerPoint, please email me.